Hey y'all, it's Dr. T here, America's holistic gynecologist, and I wanted to talk today about something that, well, as y'all are aware, it probably drives me completely batshit crazy. I make no bones about this, but I've had so many women asking questions lately that I just feel like I needed to reassess the hormone pellets and hormone injections, especially testosterone. I want to talk about testosterone in general, and then we can expand this into the other hormones, especially estrogen. But let me just suffice this to say, if you're only going to listen to the first minute or two, hormone injections and hormone pellets are horrible. Anybody putting them in my opinion, is committing malpractice, and they don't know anything about hormone replacement therapy. Anybody, let me repeat that. Anybody injecting a woman with testosterone, whether it's subcutaneous or intramuscular, or anybody placing subdermal implants into women, is committing malpractice. The companies that make these pellets, namely BioT and Evexius, that are training doctors, I believe, are doing so for profits over patients. There is absolutely no reason to do pellets. And in my opinion, they harm patients on a daily basis. Shame on the companies and shame on the doctors that are using these things. Now, that being said, maybe your doctor has the best intentions, but in my opinion, most people doing them do them for sheer money. That's the main reason. There's money to be made. Menopause, perimenopause is a huge business, as you are seeing. And women are vulnerable. Women are exhausted. They're gaining weight, suffering from insomnia. They're anxious. They're having irregular periods and decreased libido. They're not the women that they used to be. They've been to 3 doctors already. They've been told it's normal. You're just getting older. We were gaslighting them all the time. And then finally, somebody recommends to them, a friend or somebody, hey, guess what? I'm on these pellets and I feel amazing. Or some doctor says they can put you on this wonderful new thing called a hormone pellet. I used to refrain from using the brands because I think it wasn't relevant, but now it is, because these companies are just preying on vulnerable women, and they're now in medi spas with providers that really have no idea what they're doing. They go to a weekend course and think that they're hormone experts when they don't know their ass from a piece of fat meat when it comes to hormones. And also, what I see is this kind of concept of, oh, it must be a good thing because I'm going to this company that's legit and I'm paying all this money, or they're sending me for free. It must be a good thing. And they're telling me it's okay to have hormone levels that are 3 times normal, 4 times normal for a woman. So it must be okay, because why would they be telling me this if it wasn't true? So I'm going to tell you again why hormone pellets are horrible. And the same thing is going to apply to injections. Whether the injections are subcutaneous or intramuscular doesn't matter. Injections for women, hormones or pellets, awful. Men, it's a different story, because men, if their hormones go too high or high normal, they're just bigger assholes. You know, they gain more muscle. They're meatheads running around with acne everywhere and deeper voices, and they think they're cool. Who cares? But women don't need to be doing that. So, the primary reason that I don't like pellets is, one, they're expensive, way too expensive. They're somewhere between $300 to $400, even more now. And you have to do them probably every 3 to 4 months, which is about $125, $150 a month. Whereas bioidentical creams and troches, which are sublingual tablets, are about $40 to $45 a month. And if you buy them 3 months at a time, it sometimes goes down to $35 to $40 a month. Pellets deliver the same medicine as the topical cream, sublingual tablets, and capsules. They cost about 3 times as much, and the levels are horrible. And I'm going to talk about that in a minute. So, number 2, the hormone levels are too high, dangerously too high. Pellets will be explained and sold to you as maintaining level hormone balances. I've seen it on Instagram. I've seen these companies' marketing strategies. I've seen the doctors that turn around and regurgitate this bullshit that the pellets maintain level hormonal balance. Now, if you think about it, there's absolutely no way this can be true. There's no way that the pellet knows how to release hormones on a stable level. And as a matter of fact, because I've seen it 1,000 times, what it does is they insert it, and within about 3 to 4 weeks, your levels are literally 5 times normal for a woman, maybe even into the level of a man. 2 months the same, 3 months the same. Sometimes around the 4th or 5th month, I will see a woman's testosterone about twice the normal level. Now, that's 4 to 5 months after the pellet. There's no guarantee that the same amount of hormone will release on a daily basis. I have asked 100 times for them to provide to me some sort of data, some sort of study that shows that these things release the hormones on a level basis. Crickets. They've never supplied that. I've asked the companies and I've asked the doctors that promote it. Nothing. Most commonly, what I see, as I said, in the first month is levels that are 3 to 5 times normal. And then after about 2 to 3 months, you'll see a stark decline. So you're going to get this sawtooth pattern over a year, up and down, up and down, up and down. So when your hormone levels go up 2 to 4 times the normal rate, you're going to feel like a superwoman. You're going to feel good, and you're going to feel kind of high almost. And then what happens is, let's say you're 3 times the normal level. When you drop to only 2 times the normal level, or about 33% of your peak, you're still 2 times the normal level for a woman, but you're going to feel different because you're dropping. And for some women, they feel like crap, and they'll go, oh my God, I got to go get more pellets. I call this the Gatorade effect, where when you drink Gatorade, they put citric acid in. The Gatorade dries out your tongue. You're still thirsty. You want to drink more. This is a built-in mechanism. I almost feel like they did this on purpose, and they knew what they were doing to make you go high and then drop so that you are like a freaking testosterone junkie, and you go back in a couple months and need your hormones. Now, if you notice, they do 2 things at these clinics. Sneaky. One is they don't draw levels. They just go ahead and insert you with more pellets. Or they draw levels and they don't show you the results and say, oh yeah, you need pellets. Or they draw levels, you see the results and see that they're 3 times the normal, and they tell you that's fine. Lie, cheat, steal. Lie, cheat, steal. That's all this is. Number 3, it's a surgical procedure. Now they're gonna mush around this and say that it's not. And it's not surgery in the sense that you go to the operating room, but it's a procedure. It's a surgical procedure. They have to prep the skin. They have to drape the skin. It's sterile. They have to use sterile instruments. They take this big ass needle. It's called a trocar. It's huge. And they have to dig this into your butt. Okay. They've got to dig a pocket into your butt to put the pellet into. This results in bruising, infections, pellets popping out, severe pain. I can't tell you how many infected butt cheeks I've seen over the years and how many infections I've seen over the years. The problem is, once they're in, they're in. And that's number 4. Once they're in, they don't come out. And I mean, that's not totally true. Sometimes they actually pop out through the incision site. But the reality is they aren't made to come out. And if you're having side effects, then you're stuck with these damn things for 3 to 6 months. So if you have side effects from the levels being too high, or pain, or bleeding, or headache, weight gain, water retention, clitoromegaly, meaning your clitoris gets enlarged, or deepening of the voice, both of those things are permanent, by the way, mood swings, irritability, anxiety, high blood pressure, abnormal cholesterol, you're stuck with these things for 3 months, with the exception of clitoromegaly and a deep voice, which are forever. Number 5, you have to get these things put in every 3 to 4 months. Now, you're told that if you go to the office every 3 months to have the pellets put in, that's okay. That's what way it should happen. Simply put, why would you do anything that required you to go to an office every 3 months to have a small surgical procedure done? It makes absolutely no sense why you would want to do that. The cost alone should have been a derailment for most people. Then add on top of that, digging a pocket in your butt cheek every 3 months doesn't logically correlate for me. I mean, the way that they must sell these things to women must be insane for them to want to go in and have this done every 3 months. It just sounds asinine to me, no pun intended. Number 6, as I mentioned earlier, the absorption rates are irregular. Pellets are promoted as being the ultimate in stability and stable absorption rates. But as I explained, absolutely, positively, no way that is true. Ask them, as I have 100 times, 1,000 times, million times, to show you a study that shows the pellets are absorbed stably, that they don't peak and trough, peak and trough, peak and trough. There is no brain inside that pellet that releases stable levels every day. And actually, I see the exact opposite all the time. I see peak and trough, peak and trough. These medications are released at a high dose initially that slows down over time. There isn't any study that shows that it's a stable release. And to my knowledge, there never will be, because they don't want you to know how it's actually working. Number 7, show me the money. I'm going to be honest. If I put pellets in, I figured it out one day. With the volume of patients that I have just in the Austin and greater surrounding Texas areas like Houston, Dallas, and San Antonio, if I put pellets in and I had people come see me, I would profit about $25,000 a month in just pellets. I'd be rich, basically. I'd be, rich. There is a huge incentive for me to put pellets in, just because of what I do. This is a cash cow for doctors. That's why they do it. This is a cash cow for, medi-spas and plastic surgeons and dermatologists, people that had, up until 2 years ago, absolutely zero interest in hormone therapy. They could have fucking cared less. So now all of a sudden they care immensely, because the companies that make these pellets are smart. They know the way to come at a doctor is through money. It's unfortunate. It's really sad, but they know what they're doing. They're marketing it. And what the doctors are doing, I guarantee you, what they're doing is they're sending someone like a nurse practitioner or a PA that has the license to put these in, who's just working with the doctor to make a living, and they're trusting their doctor to educate them on hormones. Maybe they want to learn about hormones, and the doctor's like, well, this is a great way, and in the meantime, you'll make me a shit ton of money. Ask the people putting them in why they like pellets. If you go like, hey, why do you like these? Why would you choose this over giving me a cream? The answers that you're going to get are going to be very vague, because the people don't probably have the education to really know. There are nurse practitioners and PAs out there that do, but I guarantee you the ones putting in pellets don't, or they wouldn't be putting them in the first place. So just ask questions and then do the math and realize that the offices that are placing these aren't doing it because they think it's amazing. They've seen the bottom line. They've seen what I saw, and that I could make $25,000 in profit a month. But even despite all that money that I could make, I can't bring myself to put them in because I think it's malpractice. Number 8, who are the people putting them in? And if I haven't made friends to this point, this is where a lot more people will probably be mad at me. Simply put, the people putting them in usually have no idea what they're doing. And I say this because the majority of providers putting them in are dabblers, the hormone dabblers, the people that go to a weekend course, the people that go do some sort of online certification that means absolutely nothing. They don't have a depth. They haven't done an internship. They haven't spent time dealing with their own patients. They literally will go to the course that this company puts on for probably 48 hours. They learn some basic knowledge. They get this big folder. The company gives them protocols, blah, blah, blah. They know absolutely nothing when they get back about hormones. What they know is how to put them in and how to draw labs. That's it. And then you're the guinea pigs. Think about it. Expertise comes from years of study coupled with patient encounters, not because you went to a weekend course. Now, I have NPs and PAs that I work with that train with me for a year. And they send me patients and we go over the patients and they learn. That's how you learn. And I can guarantee you none of them are going to put pellets in because they know how horrible they are. They know the ramifications. But they also have been doing an internship for 12 months, not 2 days. That's what you want. You want somebody that has that expertise. Number 9, it's a club. Meaning, the offices that put them in have to pay to play. So if they go with BioT, they have to pay BioT a monthly membership fee. They have to join the club. That's how BioT makes money. They also most likely have an arrangement to buy the pellets from BioT. And now BioT has supplements. I love this. BioT is not stupid. They're smart. They started with their own supplement line, and what they're doing is now, oh yeah, hey doc, we noticed you don't sell supplements. Most doctors don't. Well, if you're already selling the pellets here, let's get you a multivitamin. Let's get you DIM. And they're selling supplements because I've seen this now many times from women that have gone to doctors or med spas that do these pellets. They'll come away with like 3 or 4 additional supplements, some of which are actually being used to combat high hormone levels that these pellets, when they don't do that, then why are you selling a supplement for high hormone levels? It's exactly what I ask patients. Doesn't make any sense. And most of the stuff they put women on actually aren't necessary and don't do anything for the problem that they think they're doing. Like I've seen people put in pellets that have estrogen in them, and then they'll put the patient on DIM because they think the DIM then lowers estrogen levels. Well, DIM doesn't lower estrogen levels. It never has. It never will. Or they'll put them on a pellet that has testosterone, and they'll put a medicine in there called anastrozole. Anastrozole will stop the testosterone from turning into estrogen, or they'll put the patient on Chrysin or another oral medication to like spironolactone, which will combat the effects of too much estrogen. So they'll automatically put the pellet in, and they'll give them a prescription for spironolactone. So they're saying that the levels will be great and they're not too high, and that it's okay for you to have high testosterone, but then they'll put you on spironolactone, which combats the side effects of high testosterone. You see where I'm having a problem here? Lastly, I feel like number 10, I say you're just a number. If and when these practitioners draw your blood, they take the results, they go back to their little computers, and they put the numbers in a program from the company. And they're told by protocol of what to do. Experts don't use protocols. We make the protocols. We also don't treat you like you're a formula or a number. Hormones don't work this way. People don't work this way. And I just think that pellets are disgusting. I know this is a lot to consume and it's sad. And there's many more reasons. The companies that run these have a very shaky history. The man that trains a lot of these people has stolen formulas and been sued, and The companies have been sued for false claims, and yet they're still out there because they're juggernauts and they're making a ton of information. Now, what I want to do is I want to go to their websites and I want to break down their website. So let's look at this. BioT. BioT is probably the biggest place that makes these things. Now, I'm going to click on the Become a Provider link that they have on their website. Basically, all it is when you click on that is to become a certified BioT provider. You give them your phone number, your specialty, and your clinic information, and then they reach out to you. So what does it say? They've got a drop down: signs of hormone imbalance, hormone optimization, pellet therapy process, bioidentical hormone replacement therapy, frequently asked questions, testimonials. Let's look at the one that says pellet therapy. Feel happier and healthier with bioidentical hormone pellets. Feel and look your best with the BioT method using our subcutaneous pellet approach to bioidentical hormone replacement therapy. Some patients report feeling symptom relief in as little as several hours. One, that's complete bullshit. If it's hours, that's called placebo. If it wasn't placebo and they're feeling it in hours, that means they're freaking juiced, and that means they're getting a lot of hormone. But I'm going to go with placebo. And is up to 4 weeks. Okay, so several hours to 4 weeks. Does that sound like stable levels to you? Some people feel it in a few hours. Some it takes a month. I mean, come on. That statement alone is stupid. But full hormone optimization may take up to 6 months. That's how you know this is complete trash. What they're doing with this statement is they are linking you in for 6 months, meaning you got to get at least 2 doses in you before you would even know if it's working for you, which means you've spent $800. So even if you don't like it, their providers are guaranteed to get at least 2 injections out of you, or two pellet therapies out of you. The BHRT pellets that BioT certified providers use are made to replicate the normal hormones men and women lose as they age. Now, this is a bit of a cloaked statement. It's true, the hormones that are in the pellets are the same as the ones that I use in the cream, but they don't replicate shit because no woman has hormones that high ever. So they don't replicate anything. All right, now let's go over to their other thing. Hormone replacement pellets may, they even put may in there, may balance hormones and relieve symptoms. Now, the first sentence says, research has shown that pellet therapy has helped thousands of people feel their best and achieve hormone balance. Okay, the research has shown part is highlighted, so I'm going to click on it. There is a study from 1984. This is the study that they use on their own website from fucking 1984. God, that's freaking hilarious. Anyways, the study that they click is from 1984. And it was 120 women, which is a weak study to begin with, were treated with a total of 469 hormone implants containing 50 milligrams of estradiol and 100 milligrams of testosterone over a period of 4 years. All patients were given estrogen if they had a uterus. There was marked response to treatment. Hot flushes being improved in all patients. Depression improved and a loss of libido was improved. They say absolutely nothing about the ranges. Oh, they're saying, hang on. They say after therapy, the serum estradiol exceeded the serum estrone, but remained within normal limits. Now, they don't say how long after therapy. It could have been 2 years after therapy. When climacteric symptoms returned and reimplantation occurred, serum levels of estrogen, luteinizing hormone, were within normal range for the reproductive age. So, again, very shady study that is 42 years old. That's what they use on their website. Now, you can scroll down. There's a few more studies on this page. There's another one from 1984. There's another one from 1993. There is one from 79. The most recent study that they state here is from 2001, and it's about intranasal, not subdermal. So That's their fucking research. A study from 1984. That's it. So basically what they've done is they've created an entire business model that, in my opinion, harms women. They are saying 3 million pellet insertions in our company's history. So they've harmed 3 million women based on a study from 1984. Right. Okay. That's the way I read that. Pellet therapy process. Well, let's go to their questions. Basically, what is pellet therapy? BioT certified providers receive training on bioidentical hormone replacement therapy in the form of subcutaneous pellets. These pellets are inserted into the upper buttocks area, and an in-office visit after testing is done to determine the exact quantity. That's the protocol bullshit I told you about. Every dose is customized and based on a consultation and extensive lab work. I've seen the lab work. It's not extensive. Is there more than one type of pellet? Yes, there are two major pellet therapy types, estrogen and testosterone. What health concerns? Oh, hang on. I want to see. How long do the pellets last? Pellets may last up to 3 to 6 months. And I would agree with that. I've seen them 6 months after insertion still be too high. What blood tests are required? BioT certified providers require extensive lab work, so they can't even list the labs that they use. Considering a patient's candidacy, a provider will discuss a patient's therapy moving forward. I can tell you, because I've talked to many, many patients, this isn't true. Many of the doctors putting these pellets in don't check levels. And the reason they don't check is because they don't want to know. What happens to pellets after insertion? Since pellets are bioidentical and contain hormones like those our body produces, pellets are completely dissolved and absorbed, leaving nothing behind, except for scar tissue, hard feeling skin, inflammation, just that kind of stuff. What concerns may testosterone pellets relieve? They list low energy sexual dysfunction, but they don't talk about the side effects. I don't see any of that anywhere. So let's look at testimonials. Oh, these are all video testimonials, but they've got 4 women on here. I can tell you, I've talked to women that feel good. But I often joke, cocaine makes you feel good. It doesn't mean it's good for you. Okay, so let's look at their research page. Our research commitment, breast cancer study. They published, it says a breast cancer study here. Let's look at this breast cancer study that BioT is talking about. And then they also have a study on, looks like they got a couple studies. One study here is a low complication rate of testosterone and estradiol implants for androgen and estrogen replacement in over 1 million procedures. All right. So between 2012 and 2019, men who had the clinical syndrome of testosterone deficiency received subcutaneous implants. Okay. Women who presented with symptoms of testosterone deficiency or estrogen deficiency underwent testosterone implant and estradiol implant therapy. All right. Results. Over 7 years, 1.2 million women and men basically underwent procedures, and 376,000 of the patients were women. All right. Of the women, 54% were premenopausal and 46% were postmenopausal. The overall continuation rate after 2 insertions was 93%. Now, they might have been giving it to them for free. So, I mean, maybe they just continued it because it was free. Conclusions. This study is the largest reported retrospective study to evaluate the continuation and complication of pellet implants. The safety of subcutaneous hormone implants in men and women appears to be better than other routes. Now, the overall complication rate was less than 1%. And the most common issue was pellet extrusion, meaning the pellets were going to spit out, which was more common in men than women. The thing about this study is it's so vague. They don't talk about the way that they do things. They don't talk about the dose. They say it's proprietary, so they're not mentioning the dose. They don't talk about how they collected the data. Was it patient report? Was it them answering a question? They don't talk about why more than 70% of the providers putting them in reported continuation. Now, again, like I said, was it free? Did they come in because it was free? Did they come in because they liked it? Were they, taunted into doing it? I mean, they don't really talk about it. So they then say in their complication rate that there were only 1% of the cases reported complications with extrusions and infections and bleeding being among the top three things. They did have 50 people that had a heart attack. They had 40 men that had prostate cancer. They had 30 women with uterine cancer, 40 with deep venous thrombosis, 248 that had breast cancer. So they do discuss it, but this study is really a horrible study. It's not a very good study. It's very, very vague. You can tell they wrote it themselves, self-serving, obviously. I think that, it makes sense. If you look at what they're doing, it makes sense. Now, I want to look at their nutraceuticals and cosmeceuticals. They basically sell probiotics, a sleep supplement, curcumin, DIM. They're pretty much the basic stuff. I think it's hilarious. They have hair repair stuff now, maybe because women are losing their hair because their testosterone levels are too high. They have a Her tea, which is the support of a healthy testosterone balance. It's basically vitamin, zinc, and copper. And as you remember, a proprietary blend, I hate those things, that basically has a bunch of trash in it. So, again, not a fan of pellets, not a fan of injections. You can superimpose this talk for injections as well. I have women on my page all the time telling me they love their pellets. That's fine. Like I said, here's two analogies. If you have a migraine and you take 2 Motrin and the migraine goes away, that's great. If you have a migraine and you take 30 Motrin and it goes away, that's great. Pellets are the 30 Motrin. Topical cream sublingual tablets is the 2 Motrin. You'll get the same effect, but you won't have the long-term risks if you keep doing 30 Motrin every time you have a migraine. You're going to crunch your kidneys and your liver. The same thing happens with prolonged testosterone therapy, the way that these pellets deliver it. You will eventually have to pay the piper here. It's just the way it is. If your testosterone levels are up to the level of a man's, you're going to have issues long term. It may take a year, it may take 2, but you're going to have issues. I talked to a lady last week who used to be a singer. She was on pellet therapy for 9 months and she can't sing anymore because her voice has deepened and it now sounds gravelly. And that, maybe she could turn that into kind of a cool lounge act, but she's very upset by this. And I had to tell her that it wasn't going to go back. And the provider that put these in told her, oh, that's normal. No, it's not normal. That's stupid to say it's normal. The other analogy is cocaine. I use this one a lot. People hate it, but my pellets make me feel so good. Well, so does cocaine. But you don't do that all the time, do you? Just because you feel better, I think this is a myth. We want women to feel better. I want women to feel better, but I want them to feel better within the confines of normal. I don't want to make you abnormally high. In any other medication, blood pressure meds, if I gave you too much blood pressure meds and your blood pressure dropped, you would pass out, you might die. Acetaminophen, Tylenol, if you take too much, you die. any other medication, if I gave you too much and it had a negative effect, I'd lose my license. But for some reason, we can do this with testosterone and it's fine. It's not fine. It's actually awful. It's malpractice. And I would debate any doctor putting pellets in anytime, anywhere, any place. I will debate you on pellets and I will win because there is absolutely no way to defend the insertion of a hormone pellet. No reason whatsoever. And I will close with this statement. Hormone pellets are made for animals, not for humans. Thank you for listening to my soapbox today on hormone pellets. Please share this episode with any friend, family member, or woman that you know that might be duped by pellets, and share it with any doctors that are trying to scam you into having them done. Have a good day. Dr. T, I'm out.